I turned into a large John Wooden fan. For those who don't know John Wooden, he's a legendary basketball coach and has, I forget, 10, 11 championships to his credit. But after coaching, he wrote books on success, and he wrote books on, his pyramid of success and the definitions of success. And he had a lot of famous quotes. And one of his quotes, which is pertinent for this, is failing to prepare is preparing to fail. And I think at the end of the day, that is the one line that if reps don't hear anything else, that's what they ought to hear.
Dr. Jarnagin. So once again, welcome back to VNEW Health podcast, where we tackle conversations in women's health, innovation, and breakthrough solutions. I'm Robert Greer, and today we've got Dr. Jarnagin back in the studio. Last podcast for 2025, right? So put the stake in the ground.
There you go.
And it's going to be forever on YouTube. And interesting in our conversations, I think this is a really interesting topic for us to lean into, which is what surgeons actually notice in the operating room as someone in the medical device space, as a rep. And we're going to break that down today in a quick 30-minute section. So, this is usually something that doesn't get talked about enough in sales in the world that we live in. And it's really about how professionals actually operate on ordinary days. So we're not going to be talking about closing tactics and motivation and hype. It's really about discipline, preparation, and consistency, and why those things matter far more than someone's personality. And we have someone who has seen a lot of reps go through his operating room, and we're going to find out, what are the things that work for him, and what are the things that he notices about, the young adults or older adults, the men and women that are taking care of his accounts. And so we're very fortunate to have the recently retired Dr. Barry Jarnagin.
Thank you. It's always a pleasure being here. And I think you're absolutely right. This is a topic that does not get nearly enough coverage on. And from quite frankly, from both sides of the fence, there are new doctors that are graduating from medical school, they're graduating from their training, and they're going out into the real world, and they, quite frankly, don't know how to interact with medical reps because a lot of their medical schools have quit allowing reps into the facilities, so they don't know how to interact with reps, and they don't know what's appropriate or what they should be looking for. And likewise, the reps don't get the education of what doctors really want. And so there's a huge divide between the two that is only getting larger, I think, as time goes on. So I appreciate the opportunity to be a part of this. And I think it's highly intuitive of you to do this type of podcast.
Well, thank you for that. And we certainly also like to be able to lean into the fact that, you've been a coach of basketball and young adults and older adults. And I think that's always, you've got the coach's perspective.
Right. Yeah.
And you pick up on a lot of traits. And so we're going to break those down in this short little podcast. And so, one of the things that I think about is, we're going to dive into surgeon perspective. Also, how do you establish OR credibility? And then what should those daily interactions with reps, what does that look like for yourself? Because you've got two environments. You've got the person that's going to maybe come see you in your office, and you have someone who's going to show up in your operating room. And so, first question is when reps come into your operating room, what are the first things that you notice as a surgeon before the product, before the outcomes? What's first thing that comes to mind?
So let me also bring together the coaching and the doctor together here, because I turned into a large John Wooden fan. For those who don't know John Wooden, he's a legendary basketball coach and has, I forget, 10, 11 championships to his credit. But after coaching, he wrote books on success, and he wrote books on his pyramid of success and the definitions of success, and he had a lot of famous quotes. And one of his quotes, which is pertinent for this, is failing to prepare is preparing to fail. And I think at the end of the day, that is the one line that if reps don't hear anything else, that's what they ought to hear.
That's it.
Because they need to walk in to the OR, they need to walk into the clinic office prepared, highly prepared. I cannot tell you the number of people who walk in, nice people, obviously did not know their product. And so and I tried to be respectful of them as a person, but I also was willing to challenge them on what they knew. And if they didn't know their product, if they weren't prepared and they didn't know their product, then I, in a very kind, professional way, basically said, go learn your product and then come back and see me. Because and I was trying to help them learn and grow in their world. There are some doctors who might not handle that quite as nicely as I did, but I try to be helpful and try to help people any way I can. But there's some doctors who, quite frankly, would just kick them out. I've seen doctors kick them out of the OR and just tell them to leave. I've seen them kick out of their office, just tell them to leave. They don't have time for them. But if you don't know your product and you don't know how to utilize that product, whatever it is, in the environment for which that doctor works, then you don't even get to first base, period, end of story. So to me, that's first and foremost is you got to know your stuff.
How quickly can you determine how if someone's winging it or not?
Probably within no more than 3 questions.
Okay.
I mean, I can usually tell within 5+ minutes whether they know what they're doing or not. So part of me, I try to be nice a little bit, but at the same time, part of me, I also like to have a good time. So part of me just kind of eggs them on at that point, right? I mean, and I just want to see how deep a hole they'll dig themselves. And so part of me is kind of giggling on the inside, because once I get to that, right, it's kind of like board questions. If you're taking a board question and they keep getting deeper and deeper into something you don't know about, you're done, right? And so I just let them dig their holes and then giggle on the inside. But usually within a few minutes, I can tell whether they know what they're doing or not. Now, but I've been, I did it for a long time. So maybe early on it took me a little longer, but you can tell pretty quickly.
So listening versus talking, what's that balance for you?
It depends on the rep though, So if, and we haven't gotten into what I see as the function of the two, right? But if Rob Greer walks into my office, then I'm going to start asking a few questions, and I'm going to see, does he know what he's doing, and does what he have pertinent to what I'm doing, right? Those are the two main things that I'm looking for initially. Does he know what he's doing, and does what he's doing help me? Because it's all a matter of, you might have the greatest product in the world, but if it doesn't pertain to me,
right?
Why
are you here? How quickly can you tell that someone hasn't done their homework?
Oh, that's really quick.
Background.
Yeah, that's
what
really
you do, how you do it, your approach.
Yeah.
Just more on just generalities.
Yeah, it's pretty quick because it's also a matter of, can Rob Greer relate his product to what I'm doing? Like, I'm a pelvic surgeon, right? So can Rob Greer walk in and can he immediately relate and show me a problem that I have that he can help with, right? Because the other issue is you may have a great product, but it may not solve a problem. And if it doesn't solve a problem, then, somebody has designed something that might be really cool, might be jazzy, but if it doesn't, I can't tell you how many times I've asked, what problem does that solve? And if the rep said,
so would you appreciate a question that then said, does this device? I know a little bit about your practice, Dr. Jarnagin. I certainly don't know, what you're seeing every day in the office. Does this particular device, does this help solve something that you are dealing with?
Yeah.
That's a valid question for you.
That's a very valid question. And that either comes after telling me all about, I've got this product that has this quality, right? And does that property offer any value to you in your practice? That is a great opportunity of, does this offer any value to you in your practice? And then if you get to that point, you have to know your product, right? And you have to have some idea or at least some thought that it might help, right? So you have to have all that background information,
right,
before it ever gets to that point, because it'll never get to that point if you don't have all that background information. So you got to know your product up one side and down the other, and then know what the practice is, and then be able to see, well, maybe it might connect. And then there's does it offer value to your practice? And then I can start diving deeper into, okay, well, it might if it can do this. Well, now he's got to know whether it does that or not. It might if it does that. Well, now he's got to know if it does that or not, right? And so then this topic goes from, kind of introductory. Yeah, he kind of knows a little bit about it, and to now we're diving deep into it. And I can't tell you how many times we get to that point and they don't know. And it's like, well, you're gonna have to go find out. We don't really.
Conversation's over.
How are your kids doing today?
Right.
Where do you live? Where are you from? What sport did you play growing up? At that point, it goes to something that has nothing to do with anything because they don't know their product.
And how often do you see that?
Oh, unfortunately, more times than I see somebody who really knows what they're doing, right?
Sure.
I mean, we're doing this because you know what you're doing. And I knew what I was doing. And so we had a great partnership because we knew what each other was bringing to the table in the process of helping women, right?
Right.
But this type of partnership unfortunately doesn't happen very often because the rep does not have that information inside of them. They haven't done their homework. They don't know their product. And so it never gets to the point where it actually can help somebody. Because I got to know that you know, and then, you know, and I'm not necessarily going to take Rob Greer's say. I'm going to go, okay, well, I want to, you know, let me see the data. Let me see the science. And then the rep that goes, absolutely. And they hand it to you, or they go, I'll send it to you this afternoon. And before you can finish your afternoon clinic, you've got it, you know, or before the day is over.
How many people say they're going to do that and don't do it?
Most of them don't say they're going to do it and don't do it. Most of them will say, here's the cue.
Okay.
I will try to get that information for you. Okay, well, that means that they're going to go ask their boss, who's going to ask their boss, who's going to ask their boss. And then it's going to be, you know, Dr. J, we don't really have that information. Oh, okay. Those that say, okay, yes, I've got it. I've got it, and I will forward it to you in an email, or I'll drop it by your office later today. Those people will typically get it to me. It's the ones that go, I think I can get that for you. That's those people. It's pretty rare that they come around.
So it's not the norm, so to speak.
No. It's not the norm. It's not the norm. And that, you know, that distinguishes, you know, there's good plumbers and bad plumbers. There's good electricians. There's bad electricians. You know, there's some electricians you really don't want working on your house because it'll catch on fire. And, you know, there's good doctors and there's bad doctors and there's good reps and there's bad reps, right? I mean, you know, it's not a plug and play. And I think people don't understand that. And companies don't understand that. They will try to plug and play people, and right. Then somebody will come in and they don't know what the other guy knew or girl did, and all of a sudden and you know immediately whether they know it or not.
Sure. So at a company level, what do you think they need to do better?
Well, we haven't gotten into and you know, we've only got 30 minutes and I'm looking at the clock. So, you know, it's like, oh my gosh, you know, we could talk for 2 hours on this. Because we haven't gotten into behavior, which, you know, ultimately has to do with respect of not only the surgeon, but the OR team and the OR process and that sort of thing. But so what does a company need to, I mean, to me, in a perfect world, they would have a whole entire educational process utilizing seasoned folks. You know, I'm not the only one out there who know kind of what reps ought to do.
Sure.
And to be a part of the educational process. And, you know, it's behavior, it's respect, all those things. And then it is, you need to not only know your product, but you've got to know what problem that product solves and how that fits into particular surgeon's repertoire, right?
Yep.
Because your product may be great, but it doesn't solve a problem, or it doesn't solve a problem in my world. right?
Right.
I mean, so there's all these, and I have had, again, very knowledgeable reps, similar relationships as with you, who would come and go, I've got a new product. Is this something that would offer value to you or not? And so, but they knew the product. They just didn't know whether it would help me or not.
Sure.
And the amniotic fluid injections is one of those. There's another injection of, and people would come and they go, how will this? And so they know what their product does. They have data on what their product does, and I'm looking at it to see what problem could I use that for to solve. And that's how we came up with, fixing chronic pelvic pain and or helping women with chronic pelvic pain. Is there was a product that had certain properties that would do certain things, and I have a problem that nobody's been able to solve. And so, oh, by the way, the properties of this actually help the problem of that. And so we connected the two. So sometimes it's a matter of, if you know your product well enough and you know the surgeon well enough, you can have those kinds of conversations of, what is this going to be of any value or not?
Sure.
Over a cup of coffee. And if it's not, it was great talking to you again, reconnecting. If it does, then, let's talk some more.
Sure. I think in those scenarios, you need to know the product inside and out. You also need to know the clinical data and the study and how it was designed and where it was efficacious and where it was going to be or could be transferred over from a knowledge transfer standpoint to the space that you live and work in.
Right. Yeah. Because a lot of things have similarities. Like, a lot of the orthopedic injuries have inflammation and they have pain. And a lot of the pelvic floor injuries have inflammation and have pain. And so, again, the amniotic world, they had orthopedic data on looking at what it did for inflammation and healing. And so I look at that in, what does it do for me from a healing point of view? And that's just one example but it's a matter of the rep has to start with knowing his product, right? And knowing what, and not just knowing the name of it, not just knowing that, but knowing the science of it. At the end of the day, we clinicians feel like we're scientists, right? It's knowing the science behind that. And that's where a lot of reps fail. They don't know the science behind. So they know a product and they know what it's used for, and it's kind of the check mark. Okay, I know the product. I know what it's used for. He does this procedure. So let's I want to know the science. I want to know. You're going to
ask the question, why? Why?
Yeah. Yep.
Why is that doing that?
Yep. And why is that better than what's currently around, right?
So you got to know the competitors.
Yeah, that's exactly right. You got to know, and you got to know the science behind their product up and down. Sure. So, right. So it's not just you. You got to know them too. So you got to know them. You got to know the surgeon. You got to know the other products that are out there, and quite frankly, what products are on the horizon, right? So because that. A lot of that data is known already. If company B is coming up with a product that's going to be out in a few months, you got to know that, right? You got to know that. And those are common questions that I ask. I ask about the science and I ask about what else is coming on. You got to, because we want to know those things too.
Because you don't want to get vested in something that turns out to be old technology or, all of a sudden it goes through this long value analysis and something, better for your patients comes out.
Yeah. In the old days, you came to me and said, hey, you want to try this out? And I thought it might work. And so I